Let's discuss allergic reactions versus anaphylaxis and anaphylactic shock. A normal allergic reaction occurs when the immune system mistakenly identifies a harmless substance like pollen, pet dander, shellfish, eggs, or other non-harmful substances and begins to look at them as a threat. In some cases, the immune system can also react to harmful substances like toxins or chemicals. Though generally speaking, the immune system reacts to harmless substances. This response is driven by an antibody called immunoglobulin E, or IgE, which binds to mast cells and basophils. When the allergen is encountered again in the future, these cells release histamines and other chemicals. In other words, when the allergen first enters into the body will not react with an allergic reaction. However, it will create this immunoglobulin, or IgE, so that it can recognize this foreign invader if it ever enters the body again. When the allergen is encountered again, these cells release histamine and other chemicals, leading to symptoms such as sneezing, itching, also called pruritus, hives, also called urticaria, swelling, also known as edema, and a rash that can be flat or bumpy in nature. These symptoms are uncomfortable but not life-threatening and usually affect only one system of the body, like the skin or underlying tissue. A histamine, or a key chemical in allergic reactions, acts on specific receptors in the body. The most relevant ones in an allergic response are the H1 and H2 receptors. H1 receptors, or histamine 1 receptors, cause symptoms like itching, hives, and bronchoconstriction, which leads to wheezing, while H2 receptors affect the stomach lining and increase acid production. Antihistamines like diphenhydramine work by blocking H1 receptors. This reduces many of the typical allergy symptoms. These medications are effective for mild to moderate allergic reactions, but are not enough to stop a severe reaction like anaphylaxis. Anaphylaxis is a term that is used to describe when an allergic reaction is considered severe and life-threatening. Anaphylaxis begins when a person is exposed to an allergen, causing the widespread release of histamines and other inflammatory mediators. This can lead to widespread vasodilation, increased capillary permeability, and bronchoconstriction. As a result, fluid leaks from the bloodstream into tissue, causing swelling, low blood pressure, and narrowing of the airways, which can make breathing extremely difficult. To determine if a patient is suffering from an allergic reaction versus anaphylaxis, you should decide whether or not their respiratory system or cardiovascular system is being moderately to significantly affected. For example, if a patient does have swelling of their airway, is wheezing, has a drop in blood pressure, or an altered mental status, the allergic reaction would no longer be considered minor, as it is affecting both the cardiovascular system and the respiratory system significantly, or at least enough to cause a low blood pressure and altered mental status, as well as wheezing and difficulty breathing. There is a difference between anaphylaxis and anaphylactic shock. Anaphylaxis is the severe allergic reaction that begins to moderately or significantly affect the respiratory system and or the cardiovascular system. However, anaphylactic shock is specifically when the patient begins to exhibit signs of shock or low perfusion. Patients with low blood pressure or altered mental status would not only be suffering from anaphylaxis, but also anaphylactic shock. To be more detailed, anaphylactic shock is the most severe form of anaphylaxis. The treatment for allergic reactions that are minor and non-anaphylactic in nature is to provide supportive care and transport. ALS providers may be able to give diphenhydramine, also known as Benadryl, for minor allergic reactions. However, if a patient presents with anaphylaxis or anaphylactic shock, they must first receive an IM or intramuscular injection of epinephrine. This is because epinephrine will increase the blood pressure, increase the heart rate, and decrease the bronchoconstriction. In other words, it causes tachycardia, increases the blood pressure, and causes bronchodilation. Ultimately, epinephrine will reverse the dangerous physiological changes that the body is making during this anaphylactic reaction. BLS providers can use a patient's prescribed EpiPen if it is available. If it is not available, then rapid transport to the hospital and supportive care is the only treatment you can administer. ALS providers, however, can administer epinephrine from their drug box and can administer additional medications such as normal saline or corticosteroids if indicated. Want to watch the full video? Watch the full video and get so much more with your full access membership by going to howtonremt.com or scanning the on-screen QR code now.